Advocacy for people living with HIV/AIDS is crucial in reducing the stigma and discrimination that they face. It is important to raise awareness about the disease and educate people about its transmission, prevention, and treatment. If you have a family member, friend, or co-worker who has had HIV for some time, or someone you happen to know, here is how you can be supportive. Show them care. Care stands for C. Compassion. Compassion for persons living with HIV. Compassion is not just to feel sorry for persons living with HIV. Compassion calls for action to make them feel they are loved and cared for. Here are some ways to show our compassion to our brothers and sisters living with HIV. 1. Make a commitment to take action. 2. Join an HIV advocacy group. 3. Plan an awareness activity. 4. Find allies. 5. Educate oneself and others about HIV/AIDS. A. Acceptance. Acceptance for persons living with HIV. The feeling of being ostracized, abandoned, neglected, unloved, and uncared is the most death-threatening disease one can feel in life. Thus, the greatest disease is not HIV/AIDS, but the feeling of being unloved and uncared for. Therefore, the best thing one can do to show our sincere understanding of a person living with HIV and fighting for it is to accept the situation of a person living with HIV. It is the most humane and charitable act we all can give, since we are all created in the image and likeness of God. R. Reassure. Let the person know through your words or actions that their HIV status does not change your relationship and that you will keep this information private if they want you to. Thank them for disclosing their HIV status to you and for trusting you with their private health information. If appropriate, ask if there's anything that you can do to help them. One reason they may have chosen to disclose their status to you is that they need an ally or advocate, or they may need help with a particular issue or challenge. Some people are public with this information. Other people keep it very private. Ask whether other people know this information and how private they are about their HIV status. And E. Encourage treatment. Some people who are recently diagnosed may find it hard to take that first step to HIV treatment. However, there are great benefits to starting treatment as soon as possible after diagnosis. By getting linked to HIV medical care early, starting treatment with HIV medicine called antiretroviral retroviral therapy, or art. Adhering to medication and staying in care, people with HIV can reduce the amount of HIV in their blood to an undetectable level. A level so low that a standard lab test can detect it. People with HIV who take HIV medicine exactly as prescribed and get and keep an undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV-negative partners through sex. Encourage your loved one to see a doctor and start HIV treatment as soon as possible. If they do not have an HIV healthcare provider, you can help them find one. Use HIV.gov's HIV testing sites and care services locator to find one nearby. Some programs can help with paying for HIV treatment and care. Friends, what persons living with HIV need is compassion, not condemnation. I am Father Nelson Bisco CM, a Vincentian priest, and I care for persons living with HIV.